A pleasant day and a warm welcome to your medical discussion, one of the favorite shows here at ChannelEye, iMed. Ladies and gentlemen, we were discussing about diabetes. Now today also diabetes, but in a different perspective. As you all know, the disease diabetes is a non-communicable disease, and specifically the age limit of this disease is a question. So we are going to concentrate about the diabetes which is being suffered by small children, and to do the honors we invited Dr. Navoda Atapattu, consultant pediatric endocrinologist. Thank you very much, ma'am, for joining with us and accepting our invitation. So ma'am, just having an exposure for this pediatric context of diabetes, people might think that not only aged people, not only senior citizen, but even small children can get. So can you just specify the age limit? Are there any specifications such?
Right. When we call a child is up to 18 years by definition. A person up to 18 years is considered a child. A neonate is considered up to 1 month. From birth to 1 month, it's a neonate. Even neonates can develop diabetes. There are various reasons. Usually, if you see diabetes in a neonate, it's a genetic condition.
Right.
It's a single gene defect. So, due to various genetic defects, even a neonate can develop diabetes.
Right.
Up to 18 years, they can develop any type of diabetes. There are different types, type 1, type 2, or any other genetic causes, or it could be drug induced. Certain drugs also can increase the risk of diabetes. Certain infections which affect the pancreas, which is the gland which produces insulin. So those conditions also can later on give rise to diabetes.
Right. And ma'am, as you said, like neonates and it between less than 1 month, the children right now just as it is they are born, and parents might be like they might be afraid of having, like even our newborn child might be having diabetes, and as you said, that will become only due to genetic consequences. So parents might have can we just give a proper care? We are just exercising much care for our children. With that care, can't we manage that thing? People might think, because we need to educate the public.
Right.
Yes, in a sense.
So it is a genetic disease, as I said earlier. There are two types. One is a transient type which resolves within few weeks, but still we have to control the blood sugar level. Some patients need insulin, some can be managed with tablets. So those children, those babies should be directed to qualified people to manage. And then there is another entity called permanent neonatal diabetes. Those patients, a group of patients should be can be managed with tablets, and the other group needs insulin. To do that, we have to identify what genetic component is affected.
Right.
Those facilities we have obtained through a research collaboration in a hospital in UK. So they help us with the genetic diagnosis, especially for these small children, because it's very important to see whether we can manage them with insulin or whether we should manage them with a tablet. So that facility is available in the country. All the pediatric endocrinologists know how to get the genetic test done and how to manage a little baby who is coming to you with diabetes.
Right. And ma'am, a parent having a newborn child, they might have a certain suspicion that my child will be prone to this type of a disease, because we watched a certain program and even neonates can be affected, and they might like think, how can we exercise due care for those children, and what sort of symptoms, that means how they can identify specifically or they can't identify. Can you just explain us on a little bit?
First of all, I must say that it is extremely rare. 1 in 100,000 live births, you may get one patient with neonatal diabetes. The symptoms are increased urine output, and the baby will be thirsty, and baby will not gain weight. Those are the symptoms, very subtle symptoms but detectable. Even a midwife would identify, yes, this child is not gaining weight. When a baby is not gaining weight, you have to investigate. So during the investigations, anybody would do a blood sugar level to see why this baby is not gaining weight. The other thing is urine output. They will be passing a lot of urine and also will be thirsty. Baby would be thirsty and dehydrated if they miss those initial symptoms. So it's not very difficult to diagnose. Only thing is that you have to keep an eye on the weight gain of the child, which happens very well in our country, because midwives visit the babies, and these babies are taken to the doctors during the first few months of life just to check the weight and also to check the general condition. So very rarely, we have never missed, I suppose, a little baby with diabetes, because the symptoms are so subtle and also recognizable.
Right.
When they don't gain weight, anybody would check the blood sugar level.
And ma'am, like we just talk about certain conditions, and you said that type 1 and type 2, there are numerous types of diabetes. Can you just explain us on these types?
Right. Type 1 diabetes, they can develop from 6 months to any age. Usually early adulthood, maybe up to 20-30 years of age, they can develop type 1 diabetes. That is due to autoimmune destruction of the insulin producing cells. Autoimmune means the body, one's own body produces some chemical substances which can damage the cells that produce insulin. So when the insulin levels are less, the blood sugar maintenance is going to get affected, and after a while, when the 50%, when the beta cell numbers are lower than 50% of what it should be, then the body find it difficult to maintain the blood sugar level, and then the child or a young adult or an adolescent will present to you with the symptoms of diabetes, that is increased urine output, thirst, loss of weight, and difficult to concentrate, and all these things come together.
Right. And ma'am, there's a small controversial thing. Diabetes is not transmitted from one person to another.
Yes.
We know that it is a non-communicable disease, but we know that breastfeeding mothers, they just take nutritious food because like they want their child to gain the maximum nutrition and the possible nutrition that the child expect, and in that case, will certain deficiencies about the breastfeeding thing will cause diabetes?
Breastfeeding is always protective against diabetes. Breastfeeding is the best nutrition that we can give an infant. That prevents most of the non-communicable diseases, I must say. So it is protective. Even the mother's food items are not going to cause diabetes in the child.
Right. And ma'am, certain nutritional supplements, even like if certain mothers, they are not capable of feeding their children, there are certain issues with the breastfeeding mechanism, and sometimes some children, they are not adequate with the nutrition of the breast milk. So in that cases, doctors prescribe certain other supplements, like certain, we are not able to say brand names here, but there are certain products that people used to use and doctors used to prescribe. Is there any risk of having such nutritional supplement with regard to these diabetes?
It's like this: a doctor would prescribe such a supplement only when it is necessary. If the baby's weight is not gaining with the breast milk, and if the mother is finding it difficult to breastfeed, then there has to be some kind of a nutrition. Then only they will supplement them with any other food item. The exposure to supplements can increase the risk of obesity later on in life, and obesity increase the risk of type 2 diabetes. And similarly, that will increase the risk of autoimmune diseases as well. So that is why I said breastfeeding is the best, but there are instances where it is not possible, and in those patients, the risk of getting diabetes, high blood pressure, strokes, obesity is going to be increased. That is why doctors are very reluctant to prescribe unnecessary food supplements. And giving child the adequate necessary care is not giving additional food supplements. Yes, exactly.
That means if we are having children and if we need to exercise due care to give the best to the child, just feed them using the breast milk at the proper time.
Breast milk is the best.
Right. And not having certain other nutritional supplements, because you might need to give the best out of the best to your children, but don't let them in trouble in the future. Just we need to adhere to the medical advice in that context, ma'am.
Yes.
Right. So when moving ahead, ma'am, you said about blood test and certain investigations depending on the type of diabetes, and even to just to investigate such as a screening mechanism. And ma'am, are there any differences or it's the same for the people who are just having diabetes, like elderly people or small children? Are there any differences?
No, there are no differences. Blood sugar measurement is through the blood, and the cutoff points are same as adults.
Right.
So there's no difference in the investigations that you do to diagnose diabetes. But there are certain investigations that are helpful to differentiate the two types of diabetes.
Right.
Sometimes when an adult patient develops diabetes around 50-60 years of age, a doctor wouldn't think of doing this special test. But if a 14-year-old who is little bit chubby coming with diabetes, we tend to do these special tests. Those are antibody tests to see whether this is a type 1 diabetes or some other type of diabetes.
Right.
In type 1 diabetes, these antibodies, I told you that there are autoimmune mechanisms which destroy the pancreas, which produces beta cells.
Right.
So these antibodies can be measured in the blood. So if it is necessary, we can check that antibodies and find out whether we are dealing with the patient with type 1 diabetes or some other type of diabetes. For that, we do special tests.
Special test. And ma'am, some people tend to think in this manner: if we are elderly, we are tolerable for certain disease conditions. Likewise, certain small issues will not be grown bigger when we are grown. But in small children, it exhibits as soon as possible. Now, diabetes as an uncommunicable disease, we know that it has some symptoms which is not exhibited. Sometimes the span of a decade they comes out. But in children, how long it can stay inside the children? Is it like from once starting to elevate the blood sugar level, it exhibits like within 2-3 months? Is there any particular limit?
Yeah, in type 1 diabetes, the symptoms will appear within 2 to 3 weeks. Some patients, we have diagnosed diabetes maybe 1 week after the symptoms. The problem is how soon they present to a medical facility. Some patients have had symptoms for about 2 to 3 weeks. Some have had symptoms for about 1 month. The people who come late will have other consequences. They will be dehydrated. They have this condition called ketoacidosis, which is a very serious condition if you neglect the symptoms. So these symptoms can vary from 1 week to 1 month. In type 2, they may not be having any symptoms. Sometimes we have diagnosed diabetes in obese children, those who have type 2 diabetes. There were no symptoms as such. Only with the blood sugar levels, we identified them as having diabetes.
Right. And ma'am, like we just advised in our previous episode with regard to diabetes, certain screening mechanisms and access to care, that is one of the major intentions that we exercise in these diabetes and the current day trends, because with the increase in technology, we have ample of investigations to perform in order to find what does the body does, and in the future as well. So the pre-diabetic condition, those things can be managed. And an elderly person, they can have regular body checkups or certain mechanisms, even insurance policies, they exercise some specific packages to check their medical concerns. And with regard to children, we are saying simply that children won't get such diseases. We no need to have blood sugar. Why this small child is like picking the skin and taking blood and doing investigations? So what are the proper screening methodology for a child even to diagnose their health condition?
Any child with obesity, with a family history of diabetes, with this thing called acanthosis, where this pigmentation of the skin at the back of the neck, that is a marker of insulin resistance.
Right.
And which is a reason for insulin resistance is the reason for the type 2 diabetes. So if you see a patient, a obese child with acanthosis, even without symptoms, we may screen them at least once in 6 months just to see what the blood sugar levels are. That is because they have high risk of getting diabetes with insulin resistance. But for type 1, there is no universal screening methodology to find out whether they are going to have diabetes.
Right.
It is only with the symptoms. But if there is a family member with type 1 diabetes and a sibling getting diabetes, the same type of diabetes is little bit high.
Right.
So in that situation, we can offer them this antibody test. Even before developing diabetes, if a sibling is at risk of getting type 1 diabetes, that sibling will have positive antibodies. So such a child, again, we ask them to check the blood sugar once in 6 months, or generally once in 6 months, to make sure that we identify diabetes early. If a sibling is positive for diabetes, antibodies for beta cells, they have high risk of getting diabetes. Lifetime risk is very high.
Right. Okay. So just wanted to enlighten you about the word antibodies. We will be in a current COVID pandemic. Antibodies are often talked. Don't think that pediatric diabetes is transmissible from one person to another. It's something, a different medical perspective, and enlightening on you on that particular thing as well. So madam, we'll move on to the complications. We know that severe complications are there, and it affects the eyes and even certain other sensitivity issues dealing with, and even some vital organs are affected. Is it similar for children as well?
It is similar for children, and let me talk about acute and long-term complications, short-term complications and long-term complications, because children are prone to present to us with short-term complications. When they become adults, when they do not control their diabetes as a child, adults will see these complications much earlier, maybe around 20-30 years of age, they will have all those complications. The short-term complications are if they don't take their medicines properly, if they don't control their diet, then they can present with very high blood sugar level, which is called ketoacidosis, where the patient is dehydrated, the acid level of the body is high, the mineral levels are deranged. So that is a medical emergency. We call it diabetes ketoacidosis. That is one complication. The other one is low sugar level. Sometimes they take insulin or they take the medications that are necessary to reduce the blood sugar level, but they don't eat enough for whatever they have taken. Then their blood sugar levels can go drastically down. So with that, they can even present with fits when the blood sugar levels are very low. Or before that, they can present with sweating, headache, sleepiness, and irritability. Those are the symptoms of low blood sugar that that a child can present to you. So those are the short-term complications: low blood sugar as well as very high blood sugar level, where they present with ketoacidosis. Long-term complications wise, they can have cataract, eye problems, and more importantly, their growth also can get affected. When an adult develops diabetes, after the growth, they will have all these other complications, kidney problems, the nervous system problems, heart attacks. And before that, if a child presents to you with diabetes at early ages, and if the diabetes is not properly controlled, they will not gain adequate growth. Even the growth can get affected, and the bone strength will also can get affected. They have high risk of fractures if the blood sugar is not under control during the childhood. So those are the complications, the other complications that a child would come with, the things that an adult will not present to you with. Adult will not have growth issues, but the child will have growth issues because the diabetes was diagnosed during the growing period. So if it is not properly managed, they might not gain adequate amount of height. And also they can have some puberty issues. The pubertal hormone production and the menstruation, the regularity, all those can get affected, and they will become, if it is really uncontrolled, they can become subfertile also. That means diagnosing this diabetes condition in a young age will lead to more consequences than diagnosing in an adult age. Adult around 40 years of age. That person has lived his life for 40 years. But this child is going to live another 40 years with diabetes.
Right.
As an example, if a child is diagnosed with diabetes at 10 years of age, that child is going to live with that diabetes for another 60-70 years.
Yes.
Our life expectancy is 70 to 80. So they have to live a full life. For them to live a full healthy life, blood sugar has to be perfectly controlled. Otherwise, they will succumb to their complications of diabetes.
Right. And doctor, I would like to enlighten these complications with the management. So adults manage diabetes in a different manner. So when it comes to the management of children, as a pediatric endocrinologist, you might be consulting different patients, as in you are consulting their parents to take care of the mother. How that care should be exercised?
It is an individualized care. That is the first thing. I cannot put 100 type 1 diabetes patients into a room and give a talk on management of diabetes. It's always individualized. If it is type 1, insulin is a must. There's no other treatment for type 1 diabetes. They have to take insulin. It is an injectable preparation so far. At the moment, we can give insulin only as an injection.
Right.
So that has to be emphasized. If it is type 2 diabetes, yes, initially we might give a little bit of insulin to control the blood sugar level, and then we can convert them to tablets. And later on, when the insulin producing mechanism is weaned off with time, we will have to change over to insulin in type 2 diabetes as well. But type 1 from the very beginning need insulin.
Right. Okay. So with that due care, how to exercise that due care to your child is being personalized, because each and every child cannot be perceived those perspectives in a common manner, but specified, as our doctor said, you can just proceed forward having this particular medical attention, medical care advisors, you can become successful, because children need to live their life, because they are diagnosed with a certain disease at their younger ages, so they need to live. So as parents, as citizens of the country, we need to help those people to live their life successfully. So thank you very much, Madam Dr. Navoda Atapattu, Consultant Pediatric Endocrinologist, for doing honors with us and explaining the general public about the consequences and the history and the related knowledge about pediatric diabetes, which are going to enlighten in this program. So thank you very much, ma'am. And also stay tuned with the iMed program. We are going to enlighten you with future medical concerns and many other disease conditions in our future programs as well. Thank you very much. Have a pleasant day.